Hey everyone, it's Dr. Rick and we're continuing on the gut series. This time we're going to talk about antimicrobials. It's kind of like antibiotics, but not really. It's not prescription, and all this fun stuff that I've collected is actually to treat problems with the gut, whether it's reflux, irritable bowel syndrome, SIBO, that's small intestinal bacterial overgrowth, MCAS, that's mast cell activation syndrome, Crohn's disease, ulcerative colitis. I think it's all important that you recognize that the diseases that you're suffering from or the symptoms you're suffering from now are usually because of something that you did in the preceding decade. And it's not intentional, it's very innocent. But I think that a lot of people, before they go to the doctor's office, will try to self-remedy with acid blockers that you can find at your local pharmacy or grocery store. Now, those acid blockers are great. They've been around for decades, but I think they are a bit strong and they're not supposed to be used every single day. So the acid blockers that are oldest are Tagamet and Zantac and Pepcid. Now, Tagamet's not available anymore, but Pepcid and Zantac are. And both of them are called H2 blockers. That's a cell in the stomach that secretes acid. If you can control the acid that's being secreted with that one medicine, you might be good, because it also tightens up the lower esophageal sphincter. Let me explain. Your digestive system is essentially just a tube of muscle, circular muscle that goes from mouth to the esophagus, to the stomach, to the small intestine, about 20 feet, large intestine, and then out to your butt. But it can't just be an open tube. There has to be little choke points in the tube to stop and be able to do what you have to do in certain areas. So the first cinch point is the lower esophageal sphincter. So when you swallow food, it goes through, the lower esophageal sphincter opens, goes into the stomach, and it closes so it doesn't come back up. That's supposed to be what happens. But over the course of time, with damage to the lower esophageal sphincter, eventually it will open up so that all you have to do is eat a big meal, lean forward and tie your shoes, and all the acid comes back up and you vomit. That's not good. Or at a lighter amount, you cough, and you cough up anytime you bend over to tie your shoe, you cough. That's not asthma, that's acid reflux that's coming back until it's worse, and then you just vomit up. So if that's unchecked, it'll actually lead to damage, because when the lower esophageal sphincter gets splashed with acid chronically, you essentially melt the lining and you turn it into scar tissue, and it doesn't do anything, it stays permanently open. Not good. The next sphincter that you encounter would be the one after the stomach, the pyloric sphincter. So the lower esophageal sphincter keeps food from coming up. The pyloric sphincter keeps food from going through, and you have the stomach churning or squishing food with acid in its volume. And when it does that, you mix in solid with acid, it eventually all turns to liquid. And then when it's liquidy, then the pyloric sphincter opens up, and the food that's liquidy or vomit, that just essentially goes to the small intestine, where the small intestine has these little finger-like projections, microscopic, and they're really long. And the vomit goes through those things, those finger-like projections, those villi, and the villi have a lot of blood vessels, and they essentially take the nutrients from the vomit, all the usable stuff, and they absorb it into the intestinal mucosa. And then the rest of the stuff that's not used goes into the large intestine. And that's where the next sphincter is. It's called the Ileocecal Valve. That's between the ileum and the large intestine, and you're supposed to, again, allow the vomit that's left over to go from the small intestine into the large intestine, where it begins the process of turning into poop. You reabsorb a lot of minerals, you have the bacteria in the colon use it for food, and then the bacteria pay you back. Since you fed the bacteria pay you back by giving you hormones, or controlling cholesterol, or giving the signal to lose weight. When it's wrong, it gives you the signal to gain weight, and that's not good. But that's how important the microbiota is. If you screw up the microbiota, it'll make you have high cholesterol, it'll make you have high estrogen, it'll make you get fat. And it has been proven time and time again. That's why this invisible organ called the microbiota is so important, but yet we don't embrace that. I think a lot of people have heard about the gut microbiome project from about 10 years ago, but when you ask about it, or you ask, what can we do? Can we support it with antimicrobials? Can we use slime to take care of and repair the lining of the small intestine and large intestine? Can we use charcoal? Can we use humic and fulvic acid? People will stare at you like you're talking in a different language, when in actuality a lot of this stuff will calm the stomach and the digestive tree, and usually when you do that, everything else works great. If you haven't noticed that, think of an athlete, all muscular, fine-tuned, low body fat, really focused on the game, but yet he's bloated. That's not going to be a good performance on the tennis court, on the basketball court, in a football game, in a track and field event. You can't have bloating. So what does that athlete do? The athlete usually doesn't eat, so they don't get bloated. When in actuality, they should be listening to those symptoms and seeing a functional medicine doctor. So a lot of my colleagues don't really address the microbiota. I think that a lot of my allied colleagues, the naturopathic doctors, have really done well. The naturopaths don't, in the state of Illinois, they don't prescribe prescription medicines, but they do know about healing and health. And because they don't prescribe, I think they have to rely on alternative means. That's why I think they're very good with what they do, most of them. So it also depends on your training. So let's get into it now. But I've put down 8 little bullet points, and the first 3 really have to do with mechanics. The first important thing is to recognize that you might have an acid issue. If you're feeling acid or burning, or you have that issue where you tie your shoes and you feel stuff coming up, well, there's something wrong with the lower esophageal sphincter, or you're making too much acid. And typically it can be repaired, but you have to figure out why you're doing it. Is it because of the food you're eating? Is it because of the alcohol you're drinking? Is it because of the coffee that you're having? Is it because of the stress that you're not neutralizing? All those things are important. Is it because of the big meal you have and then you go lie down at night and watch Netflix? All those things are important, and they usually are just poo-pooed, so to speak, by your primary care doctor or you. So I'd like you to invest and figure out the root cause. Next is you have to regain propulsion, because a lot of us, I've heard people say, well, I'm constipated. That's normal for me. Everybody in my family is constipated. We only go once or twice a week. That's not normal. Honestly, you're supposed to poop every day. If you think about what the gut does, is that it helps you digest food. It also helps you eliminate bad products you don't want in the body, because the stomach, the small intestine, the large intestine, they all has ways to absorb stuff, but they also work as filters to keep crap out. So if you're having issues with propulsion, like you're moving your bowels once a day, that means things aren't moving along. They're stuck somewhere until that once a week when it explodes and you get to release something. You probably release little small rabbit pellets, but those toxins that the body's trying to get rid of get to stay in the colon, and that cannot be good. It's not just a vessel for storage. Again, I said that's an invisible organ, the microbiota. And in the small intestine, you don't have many. In the large intestine, you have an army. Some papers say 500, some papers say 4,000 different microbiota species. So of all those species, they each have a role to play to keep you healthy. And of all those species, they also have a different food source that they desire. So the wider your variety of foods, the better you feed the 4,000 different bacteria in your army. When you have a problem with propulsion, sometimes you'll keep crappy food in the large intestine being exposed to your invisible organ, the microbiota, for a couple days. That's not good. It's either going to sit there and kill, because you're trying to get it pooped out of you because it'll kill you. But if it stays in the colon next to those 4,000 different microbiota, either they're going to be bulletproof to it, meaning that they'll be tough, and usually the tough bacteria are the bad ones, or you're going to destroy the microbiota. So one way or another, it's not good. Here's the other thing. When you get rid of your own hormones, say, I did a video on testosterone being broken down into estrogen and being pooped out. Well, if it's conjugated, it'll be pooped out and into the toilet. But sometimes you can have a bacteria or two cleave that complex, and then you'll reabsorb the estrogen back in. And those of you who have gone through breast cancer, ovarian cancer, uterine cancer, you don't want to have, especially if it's receptor positive, you don't want to have extra estrogen in you. And guys who are bodybuilding are just worried about developing muscle, losing fat, losing boobs, you don't want to have extra estrogen in you. It's really important to move once a day. So if you're only going once a week, I think we have to talk about getting propulsion going. So there's certain herbs here that work on propulsion. We'll talk about that in a second. And then finally, Sphincter Health. And that's where I already spoke about that. Lower esophageal sphincter, the pyloric sphincter, the ileocecal valve, all those areas are important. Even those smaller sphincters are hofstra of the colon. The colon is made up of these hofstra. Essentially, those muscles, when ready, will push, and push. They'll push the poop out. You can actually manipulate the viscera. You can actually manipulate your belly. I've seen some naturopaths do this. I've seen some chiropractors do this. Manipulate the viscera, the stomach, to move the contents of the colon out. And we do that in yoga with wind relieving pose, it's called. You squeeze the right side, you squeeze both sides, and you squeeze the left side, and it's supposed to encourage air to leave. It's also supposed to be very healthy and self-massaging. But bottom line is that if you control the acid of the stomach without taking an acid blocker, if you control movement, which is propulsion, like with a prokinetic, and you can use a medicine too. There are certain medicines that do that as well. And then if you can control the sphincter, or the muscular contraction, which is part of the propulsion thing, then you have a better functioning digestive tract. And when that functions, then you just have to worry about the microbiota, the invisible organ. Hopefully everything will come together and function properly, and you'll be just like a young person, not gain weight, feeling better, energetic, sleep properly, and digest well. Let's talk about what I usually suggest. I've done videos in the past where I talk about getting slime in. Whether it's excessive acid in the stomach or a denuded, irritated small intestine with shortened villi. So those finger-like projections are supposed to be tall fingers. But sometimes with a lot of damage, you'll have shortened villi, and they won't absorb as much, but they'll still work kind of, especially after having food poisoning. But sometimes what you'll want initially after the food poisoning, or if you needed chemotherapy, or if you had to have antibiotics before a surgical procedure, and all those finger-like projections are shortened, you want to heal those finger-like projections. So you have to take in slime. Certain foods essentially produce more of a viscous slime. And acacia is one, and so is psyllium husk. I've done videos on psyllium husk before. Those of you who used to follow me back in 2013, I would pour a psyllium husk into a plastic glass of water. I would stir it up and I'd eat it during my mornings, and that would be my slime for the day. It would help me lower cholesterol, also help me fix my microbiota. Acacia is a little bit easier than psyllium husk. Psyllium husk solidifies and gels up fast. Acacia doesn't gel up as fast, so it's easier to do a shot of it. So acacia fiber is one. Marshmallow root and slippery elm are my two go-tos. It's one or the other. They both have different properties, but both of them, they put these capsules in a glass of water and leave them for a couple hours, you'll see it turns into slime. It would be faster to see the slime if you break open the capsules and just dump the contents in the water. And that's what they do. They form slime or a slippery, viscous material to patch up and create a biofilm. The easiest one to describe is DGL. I love this stuff because most of my patients take Tums to take care of stomach. I would take an H2 blocker like Pepcid or Zantac. I would not take Prilosec. Prilosec is very strong, and if you have, say, Barrett's esophagus, which is a precancer from all that splashing of the acid, well, it's too late. You have to be on Prilosec for the rest of your life, but it reduces acid so much that there's no more acid, and if there's no more acid, you got a big problem. We'll talk about that in the next video, but DGL, specifically when you chew it, mix it in with saliva and swallow it 5 minutes before your meal, it essentially coats the stomach with foam. When you coat the stomach with, it's not really foam, it's more slime, but when you coat the stomach with the DGL, the licorice, and your saliva worked together, it'll take care of any rough patches and it'll make you feel better. Tums is a little different. Tums works by changing out calcium, but the problem is after you take the Tums, it might reflexly cause a calcium wave to irritate you. So I'd rather have you take DGL. And it tastes like candy. It tastes like licorice. So even if you don't like black licorice, it's pretty decent. So these things I've talked about before as far as biofilms, to help heal the gut. So not only does biofilm help heal, say, an erosed patch of stomach or small intestine or large intestine, the biofilm is also a home for the probiotic. I don't have any probiotics. I'll be talking about that next video. So, by the way, if this is the first time you're finding me, thank you and welcome to the channel. But don't forget to give a thumbs up if this helped you, or pass this on and share this with other people that might be in the same situation. And this is not meant to be medical advice, so take this information to your doctor and see how it pertains to you. This is old stuff, but I still rely on it for my folks that go through food poisoning, rough patch where they have a lot of bloating, and they're trying to get back to the norm. I would suggest prebiotic before probiotic because it works better. If you take a probiotic and you've had those shortened villi, the probiotic will be asking for food. Remember, probiotics are bacteria. There are different bacteria that you'll find in the gut, and there's about 4,000. I don't think there's enough probiotics in the vitamin store to replace all 4,000. If you look at your average contents or ingredient label, they're usually bifidobacter and lactobacilli, and then you'll find Saccharomyces sometimes. But those are like the three biggest subspecies. There's 4,000 different species, but a lot of them cannot be made or cultured outside of the stomach or the intestines, so that's why you can't put them in a pill. But bottom line is that if you haven't had too much damage to your microbiota with multiple rounds of antibiotics or chemotherapy, then even though it's been a while, if you're in your 40s and 50s, you can still reinitiate and bloom some of the microbiota by feeding them the right foods. Now, the problem is that those of you who've gone through SIBO or MCAS or food allergies, you've probably whittled your food sources down to a couple of different ingredients that don't cause a reaction. And to survive and decrease the symptoms and decrease the bloat, you're probably just staying in that space of a few different ingredients or a few different food sources that don't irritate you, and that's fine for a short time. But what you're supposed to do is eventually you have to get back in and reintroduce one thing at a time. You can usually introduce one new thing for about 3 days just to see if it does anything at about a quarter of the previous dose that you would find in a helping, and you watch and observe, don't make any other changes, and then you do it again. If you had a bad bloat, then you decrease it by even more, and you do it the next day. If you tolerated it without any bloating, then you might increase it to 3/4 of a serving. But you keep on doing that until you're tolerant to that. You put that in your good list, and you add the next thing in. And you keep on building up. Remember, of those 4,000 different bacteria, each of them requires a different plant source. Unfortunately, the bacteria are not fed by meat sources, they're fed by plant sources. For those of you who are carnivores, I mean, you're going to reduce the irritation and the bloat, but eventually you have to feed those sources, otherwise your gut diversity will narrow down. So if you have a fish tank full of 100 different species, and each of those fishies takes a different food source, a different food flake or fish flake, and you only give one type of flake, you'll have one dominant species that will take over the tank, but you'll whittle away the others, especially the exotic ones. And that's a shame because it brings life, because there's variety in the tank. And the tank too is an ecosystem. You have to have bottom feeders, you have to have hunters, you have to have dwellers, you have to have different fish to make up your aquarium. Same thing in this. You have to have different bacteria that do different things, different times of the day, and they digest different food sources. So it's really important to have a wide diversity. And the only way to have a wide diversity is to have a wide array of different fish food. So if you're just sticking with a narrow source, you'll decrease the symptoms of your bloat and your IBS, but you're also going to narrow down the probiotic that you have, and it's not good in the long run. So try to get to a nutritionist who can help you, or come to see me. I'll put my link down below. I do internet consults virtually. So I might be able to help you or give you some coaching ideas. See, so one thing we do is, if you've really been robbed of the building blocks for good gut health, this is one of the basics. It's humic and fulvic acid. And these two acid components are always used in soil. In fact, when a farmer wants to fix his soil, he'll have to assess the nutrients in the soil before he plants so that the investment in planting of the seeds is fruitful. In many cases, farmers will always try to get humic and fulvic acid in, and this is a great combination. It's called dirt, but if you put this in water and you use it on a regular basis, it will give you those two acid components to lay the framework down for the negative and positive charges that come off of those finger-like projections. So the basics to what happens in the gut are you have from the innermost lining to the lining or lumen of the gut where the bacteria are, you have essentially the white blood cells. The white blood cells are there to fight any invaders that are coming through the lining into the bloodstream. And in fact, 70% of your immune system is located in the small intestine in Peyer's patches. And that's why it's really important to address. If you have problems in the gut, you're probably going to have problems with your immune system, if not rectified. So it's often said that when you have rashes on the outside, eczema, psoriasis, you're going to have issues with the gut. It's a barometer that there's gut problems. So if you take care of the gut, then the rashes go away. It's very common. But again, the link isn't there. Dermatology uses lotions and potions and different creams to take care of things from the outside without addressing the true cause, the root cause. And I think the root cause is going to be the stomach. But humic and fulvic acid is always a basic building block. And then you use a slime. And then you can use other things. These are prokinetics, iberogast and ginger. I did mention that to regain propulsion, you have to get gut contents to move from the stomach to the small intestine to the large intestine. The best time to do that is usually at night when you're fasting. In fact, when you eat, you slow down propulsion. When you fast, you move along. So typically, what I would suggest would be ginger root or extract, about 1,000 milligrams a day. You can take all that at night, but you have to throttle this because ginger can also be heat. So you have to be careful. I'd start with, 200 to 300 milligrams at night, see how it treats you, and if you can tolerate it, do more until you can't tolerate it anymore or until you reach 1,000 milligrams. The other is iberogast. This is a little pricey. This is about 10 bucks. This is about 30 bucks. This is a homeopathic medicine. Let me show it to you. Iberogast. You can get it on Amazon. Same thing with this, or you can go to a Fruitful Yield for this. Iberogast is several different homeopathics. I don't know if you could see that, but that's the homeopathics. And the idea is that it works to decrease the irritation to the lining of the gut. So there have been studies on iberogast. The STW5 was what they coined the chemical name as, or the experimental name as, but essentially no side effects. And it had positive, good effects in healing the gut. So usually that's the thing with homeopathic. Homeopathic medicines usually don't have any side effects. In fact, they're so delusional that some of my colleagues will say, well, you're not even taking anything. So does it do anything or is it all placebo? But it's not placebo. It does work. And the combination of these microdoses works great. Again, it has been studied. STW5 has been studied, and that's this. And you could check out the study yourself, but I think it's very good for propulsion. So I would use that at night as a prokinetic. Or I'd use the ginger at night as a prokinetic. Again, both of these you might have to get used to, because if you're used to moving your bowels once a week and then you suddenly take this, you're going to have to go. You're going to feel the urge to go. It might not be immediate, but you might associate quick urge to go as, uh-oh, I got a problem, I have an accident coming. So I need you to work with your therapist or to reverse that associated feeling, because a lot of us have that. I remember mine. I had amoebiasis in the Philippines from eating, I had mami. That's a noodle dish. Be prepared, because it might make you go. And that's okay. Even folks with diarrhea, believe it or not, even if you have diarrhea, that might be diarrhea that's just coming out of the colon because of something that you're irritated with. But the small intestine is where you want this moving. In fact, small intestinal bacterial overgrowth usually is because the movement is so slow that the contents of the colon goes backwards through the ileocecal valve, and the colon, with all of its 4,000 different bacteria, goes back into the small intestine and starts to populate the small intestine with all 4,000. That's not good. The small intestine was not made to have that many bacteria. When that many bacteria get into the small intestine, the white blood cell system, immune system, gets overrun. And when it gets overrun, you start to have a fight, and you mount a response. The immune system starts to send a lot of white blood cells into the small intestine, and it's important to always keep moving. And that's why SIBO is worsened by constipation. So if you have diarrhea, don't worry. But if you try a prokinetic, it's just to get the gut moving at night so that the morning will be a little bit better. You shouldn't have worsening diarrhea. It just makes the SIBO better. So hopefully that makes a little bit of sense. But bottom line is that you have to partition off the stomach from the gallbladder, from the small intestine, from the large intestine. You have to partition it because there's totally different bacteria in each of those areas. The stomach, there's not that many bacteria because of the acid, unless you're taking an acid blocker. And if you are taking an acid blocker for the rest of your life, you're going to have a shitload of bacteria in your stomach that get into the small intestine, and that's not healthy either. That's going from a top down with bacteria versus a slow peristalsis and the bottom up with bacteria. But either way, small intestine, not supposed to have that many bacteria. If you are out in a function and you have no choice, all they're serving is bad food. What you can do if you know you're going to be bloated, charcoal. This is charcoal. Charcoal absorbs a lot of gas. Charcoal absorbs a lot of stuff. If you have a toxin that your kid just ate or ingested, 2 capsules every 2 to 3 hours of charcoal will take that out and put it into poop. You'll end up with black poop, but you'll also take the toxin out in the poop with it. So that's important. So it's nice to have this if you're going out and you can't control. Like you're going to a wedding, you're going to a meeting, you're going to a function with your boss, and you know they're going to serve you some ice cream, and you can't have ice cream, but you know it's impolite. I also use essential oil. This is Young Living's Digest. I like this. It's got a nice flavor to it, but it topically will calm the stomach. Now, whether this is placebo or not, I'm not sure, but you can have aromatherapy that helps to calm down the stress response. And if you calm down the stress response, you do reduce the acid, and you also reduce that irritation. Remember, even if you don't talk about acid, when you're under duress, there's a lot of things that happen with the chemical signals to the small intestine, large intestine, and the stomach. And that's why people who are under duress usually have ulcers or diarrhea or bad acne and rashes, because the digestive system just can't function when it's under stress. The digestive system functions best when it's in love. When it's under stress, the digestive system paralyzes. So that's why it's important to have your practice. If you're totally stressed out, you have to have somebody teach you a neutralizing practice. That's why it's really important. You have to see a counselor, please. Don't just say, I'm not stressed out, and tell me that you have all these issues. It's always going to be related, so don't belittle that. It's very valuable to have counseling and have your own mindful practice. Now on to the antibiotics, or the herbal antibiotics. Triphala. Triphala, I always thought Triphala was just an Indian herb that was used as fiber, but it's not. This stuff it actually has an antimicrobial property to it that decreases inflammation. If you check out the paper, it goes through, I'll give you a closer view. It goes through a lot of the mechanisms of how Triphala was evaluated to be more than just a fiber. And I think what it does best is it decreases, or I should say, decreases the inflammation to the small intestine and increases the finger-like projection length. And in fact, let's talk about Triphala and berberine. I've talked about berberine as far as lowering diabetes or lowering your glucose levels. Well, berberine, believe it or not, also has a method to it where and it's been studied too. This stuff is great. So I love berberine. Not only will it reduce glucose, it'll reduce LDL cholesterol, and it'll save your microbiota. So this is what happened. I'll tell you why in a second. This is a print up from this study, but it talks about all these bacteria here and how they're affected within 12 weeks, 13 weeks of treatment with berberine. So berberine essentially does a couple of things, but one of the most important mechanistic actions is that it controls the way deoxycholic acid is utilized in the gut. That's a breakdown of bile. And when you can control the bile, at least how it's metabolized, then you control the way the bacteria that eat the metabolized bile work or blossom. If they're bad, you don't want them to blossom. And that's essentially what berberine does. So a lot of those bacteria that we have in the gut can be labeled as hydrogen producers, hydrogen sulfide producers, or, well, gas producers. Let's call it gas producers. And when you get the gas producers that get fed their specific fish food that they need, then you're going to have a lot of gas. And those aren't really the best bacteria. So you have to learn to throttle or control that population and bloom the other ones. Sometimes it might be, don't take the foods that feed the bad guys and the gassy guys. Take the foods that feed the non-gassy guys. That's fine. But I still think that there's a wide variety of different food sources you have to experiment with. But if it's just a matter of maybe adding a little bit of triphala, a little bit of berberine, or garlic extract. This has to be allium-free, but I had this one for cholesterol. Garlic extract also produces effects that help with dyslipidemia or cholesterol, like I mentioned, but it also helps heal the gut too. This is a shorter paper, but again, there's papers that show, and there's more of them out there. So these three are considered very good antimicrobials to help with the bacteria. And I haven't even talked about an antibiotic. There is one antibiotic, I'll probably talk about that next time, that it's specifically for small intestinal bacterial overgrowth, because the antibiotic only stays in the lumen of the small intestine and large intestine. It doesn't get absorbed into the human bloodstream. So it just sits there. I think it's because the molecules are coated, but it just sits in the lumen and it kills most bacteria. So the idea is that if you are overrun, I think about war movies, they talk about guys, the platoon is on a hill and the hill's being invaded from all sides by the enemy. And you'll hear the leader at the last minute say, broken arrow, broken arrow. It was a Mel Gibson movie. Broken arrow, and that usually means you call in an airstrike to level your spot. And it sounds like you're going to kill yourself, and you effectively are. But in sending, the only benefit is that you know that the artillery is coming in, so you can take cover. Versus the invading horde, they don't know the artillery is coming in, and they'll get blasted. So that is a way to kill off bad bacteria. You're going to have collateral damage with good bacteria, but you hopefully will be able to, after wiping out the bacteria, and again, I'll talk about this next time, you'll be able to repopulate and have a good gut diversity, maybe even consider a fecal microbiota transplant. That's number 7. So the only way to think about repopulating your gut with good bacteria is to take somebody else's poop. Believe it or not. You take a healthy donor that has been proven to be disease-free, slim, and maybe good-looking, and then you take their poop and you have the poop put into you by a GI specialist. And it has to be done with a colonoscopy. I don't think the idea of taking poop in capsules sounds too appetizing. I think they're called crapsules. But you can do that versus doing it the other way. I think doing it the other way is better, because if you take the bacteria this way, I think somebody actually has that. You have to have the bacteria survive the stomach acid and survive the bile and then get through the small intestine into the large intestine. It's better just to do it through the large intestine. I'm working with Cancer Treatment Centers of America to try an experiment where I give the FMT to more than just people with C. diff. Right now, the only people that can get fecal microbiota transplants using the GI technique are people with C. difficile infections. But it has been documented, especially with the Gut Microbiome Project, that it benefits everybody, even obesity. If you look at the animal studies, you take a fat mouse's poop and you put it into a skinny mouse, and the skinny mouse becomes fat. Now, if you take a skinny mouse's poop, put it into the fat mouse becomes skinny. That means that obesity is controlled by the invisible organ, the gut microbiome. So that's why I had mentioned taking your poop from a thin, good-looking person. Maybe you can turn good-looking, who knows? But we're working on that, and I'm not sure if it's covered by insurance. And then there's always going to be elemental diets. I'll talk about that next time. Those are diets that you'll refrain to when you have an attack, And it's kind of like a FODMAPs diet. FODMAPs is meant to reduce irritation in people with a lot of gut symptoms. But it's not meant to be maintained forever because it's very narrow. There's not enough nutrients in that. So you have to break out sooner or later. But a lot of people just keep on existing with that narrow spectrum or that narrow window of food. And I don't think that's healthy. So, but if you talk to a patient about reintroducing food and then they start to have a bloat again, that's very discouraging. So you have to work with them about the apprehensions that they'll have about maybe microdosing food, slowly reintroducing certain foods, and then maybe working with other things, probiotics, microbiota, a lot of these antimicrobials, prokinetics. So there's a lot of cool stuff here, and I'll talk about this next time as well. If you wanted to check your bacteria, this is to check the gut microbiome. This is to check if you have a gas-forming problem. So stay tuned. Please consider subscribing. Thanks for watching up until this point. If you have any questions, put them in the comment section down below and give a thumbs up because it does help the channel move forward. I like to do these videos for patients. Calm down, calm the gut down, have a relaxation practice, eat right, exercise, get some sleep, and I'll see you at the next video.